Hi, everyone. I am so excited to be here. My name's Emily. I am the project manager of the Equity Counts Partnership Initiative at the United Way. And I'm so excited to be here with you all to celebrate the official launch of the Equity Counts Data Center. There's so much that has gone into the creation of this data center, and we're so excited to share it with you. We're going to hear from a number of people during this hour and hear about their individual contributions to the creation of the Equity Counts Data Center. With that, I invite Dr. Michelle Taylor to speak. She is the CEO of United Way of Delaware, and she is going to offer her opening remarks.
Good afternoon. I hope you all can feel the level of excitement we have through this Zoom this afternoon. It is an historic moment. Delaware is taking the lead in focusing on equity and the measures or indicators that will intentionally help us to develop innovative strategies to close the disparity and opportunity gaps. It is about systemic and institutional change. But it's also a divine moment. Tasha Coleman from the Smithsonian African American Institute spoke the other night at the First State Community Action event and reminded us about Proverbs 18:21. Life and death are in the power of the tongue. This proverb reminds us that we should watch our words carefully and that we should understand that there's power in our words. Sure, you've heard it many times before. If you say you can't do something, you won't. But if you say you will, you will. And that there's always a way if you put your mind to it. As I reflect on this and what it's taken to get to this moment, I'm reminded of how a single vision became a collective vision. From ideation to plan, from plan to execution, from execution to launch, because we kept saying, we can do this. I'm so grateful for our partnership with DPH and their leadership for seeing the possibilities. Thank you, Tasha and Lisa and Laura and Sequoia, and for making this a reality alongside of us. This is absolutely a joint effort. And to Cassandra Coach Johnson, thanks for connecting the alignment between the Delaware Racial Justice Collaborative and DPH, and for helping us to incubate the Equity Counts Data Center, and for finding a home within my healthy communities. You got the party started. The ECDC, which we are calling it, is a labor of love between DPH, United Way of Delaware, DRJC, Green River, and so many others. It's a love for data, it's a love for our community, and it's also a love for a just and more equitable Delaware. The Equity Counts Data Center is designed to be a single source for researchers, community partners, funders, legislators, change agents can get critical data about the state of our state. We embarked on a plan to build a data platform to illuminate and drive action to address systemic racism, inequities. The goal of the Equity Counts Data Center is to inform, provide localized data that can be used to make changes at both the grass tops and the grassroots level. And the site provides a platform and a framework for us to build upon. But what you will do with it is where the real excitement lies. Thanks to partners like Highmark Delaware, who also saw the vision and the potential in ECDC, where we have launched the Equity Counts Data Center Partnership to build the capacity of organizations to leverage the data to fuel innovative solutions with 7 amazing organizations. You'll hear more about this in a few minutes. Thanks, Danae, for creating the opportunity, and to Kirsten, Paul, Peggy, Sarah, Aaron, Sierra, Daryl, and Renata for championing this effort and leading the change for others to follow. Thank you to the team again at United Way and at DRJC, DPH, Green River, and all the partners who shared their thoughts and expertise around equity and data. Our collective team took us from concept to live website in less than a year. I have to acknowledge the leadership of Gwen Angelette, Fauna Drayton, Henry Smith, Lori Girardi, Raina Allen, and Emily Kaufman. This is what an A-team looks like, and they help to provide the heartbeat of this work. As you hear more about the ECDC, and as you go into the site, we want to hear back from you. You'll hear that over and over today. We want to know your thoughts. We want to have your feedback. It's important to us that we continue to listen as we build out the next generation of this. So as I close, if some of you probably have seen the ultrasound before. So as a mother, when I had my kids, they gave me the picture, right, of the ultrasound that was my baby. And if you've ever seen one and you have it at 8 weeks, you're looking at it and it really doesn't look like a baby. There's this level of excitement of what's to come. It's not necessarily in the picture that you're holding up, although you share it with everyone to get them excited about what it is. And as a mother, right, who's personally holding and carrying this baby for 9 months, you endure the morning sicknesses, the kicks that come, the changes with your body, all because you know you're about to birth something great. That's kind of how it was with ECDC. The newborn baby that we have, right, doesn't look the same when they're 5 or 15 or 25 years old. And as excited as we are about this moment and this launch, we are more excited about the next and what it will look like when ECDC grows up. Because a group of caring and resilient and committed individuals nurtures it and kept speaking life into it. That's where you come in. That's our role in the community. Thank you. At this time, I'm going to turn it over to my colleague, Raina Allen.
Hi, I'm Raina Allen, Director of the Delaware Racial Justice Collaborative. We are a movement of over 200 strong, individual and organizational members. To advance the fight for racial justice, we're doing things like creating the Equity Counts Data Center, creating a directory of Black doctors in Delaware, and hosting a screening of the Oprah Winfrey produced documentary, The Color of Care, about health disparities this Saturday at 1 o'clock at the Wilmington Public Library. To our DRJC members, thanks for coming. For those of you for whom this is your first DRJC experience, welcome, and I hope it won't be your last. And with that, I'd like to introduce our partner, Dr. Tabitha Offord-Powell, the state epidemiologist and chief of the Epidemiology, Health Data, and Informatics section in the Delaware Division of Public Health. She has over 20 years of public health and epidemiology experience at the local, state, and national levels. The floor is yours, Doc.
Good afternoon, everyone. It is truly an honor to be here. This is so amazing, the work that's been done. BPH is truly honored to be hosting the Equity Counts Data Center on the My Healthy Community platform. I'm going to tell you a little bit about the history of My Healthy Community and where we are today. Health and the environment in which we live are inherently connected. There is a critical need for communities to have access to data about the communities in which they live. My Healthy Community was born from this need, a need that was shared by our community partners and through discussions with public health leadership. Our journey began in 2014 with a conceptual framework and proposal with a vision that Delawareans have access to usable, meaningful, timely, and high-quality data about the health of the communities in which they live. To make this concept become a reality, we evaluated data platforms and websites, identified a small amount of seed funding, and brought on board a vendor, Green River, who also had recognized the significant importance of what we wanted to create and accomplish. What we found was a wide array of platforms. What we didn't find was a platform that presented the data compiled in an easily digestible format for communities. And with that knowledge in hand, we embarked on developing My Healthy Community. different from other data platforms, informed by community needs and expertise at the intersection of health and communities, epidemiology, and informatics. My Healthy Community Data Platform was launched in May 2019. So now we fast forward to today. Over the past 3 years after the initial launch, My Healthy Community has served as the COVID dashboard and is continuing to grow. Today represents a landmark day for us to be able to further make this vision a reality with a focus on health equity and empowering communities through data to affect change. My Healthy Community explicitly seeks to put equity at the center of public health by providing actionable community intelligence to support, inform, and improve the delivery of coordinated neighborhood-targeted public health strategies. Through a collaborative process and partnerships with the United Way, Public Health, Delaware Racial Justice Collaborative, Green River, and many others, the Equity Counts Data Center was designed and developed with communities in mind and extends the ability of My Healthy Community to serve as a tool for Delawareans. The Equity Counts Data Center collects, curates, and analyzes Delaware-specific data related to racial equity and social justice across many sectors. Together, we are providing ongoing support to ensure data are accurate, comprehensive, and actionable. Together, we intend to grow the platform to increase its usefulness and inform equity across Delaware. Thank you.
So next we are going to have Dr. Gwen Angelette speak about social determinants of health and more about the equity pillars that were used to create Equity Counts Data Center.
We want to move to a little bit of audience participation. We have a couple of polling questions that we would like you to respond to, and here they are. So let's take a few minutes and put in our responses, which describes your role in relationship to data. And then in the last 30 days, how often did you use data in your work? We'll give you a couple of minutes to fill in your responses. Have we got most of our responses in?
It looks like people are excited in answering the first question. So we'll just give them another couple of minutes. We have 61 respondents so far. And now we have people who are moving on to the second question. And here we go. I'm going to show the results on screen.
Okay, so we have the majority. Well, actually, it's pretty close between 1 and 2, with 53% of our participants today saying that data informs the work as their primary focus, and 47 that say that informs the work, but not the primary focus. Now, moving down to question number 2. Oh, we like this number, or this response. Most people said that every day data is a part of their work. And we hope that the Equity Counts Data Center will be a part of your resources when you're looking for that data. What you're looking at is a chart that really focuses on the social determinants of health. In developing the DRJC, we decided that the social determinants of health would be an excellent framework, for looking at the inequities that impact the health and well-being of some of our most vulnerable populations. These determinants affect every aspect of our life. And if you look at the chart, you'll see that the socioeconomic factors and the physical environment account for 50% of that equation. And if you look at that, you can see that you trace that back to the zip code, the area where you live. So you can see that place matters. The children that are born in Hocassin in zip code 19707 may have different outcomes for those children that are born in Wilmington in zip code 19801. The Equity Counts Data Center on the My Healthy Communities platform, helps us to tell that story of those children using Delaware-specific zip code data. It helps us uncover the equity gaps that exist at a more granular level. And when we talk about the us in this equation, we're talking about all of us, in the community. The indicators that we can use to help tell that story are really embedded in the pillars of equity, as you see on this chart. These pillars are the organizing frame for the work of the DRJC. In examining the indicators, and these indicators are guided by the social determinants in these 4 focus areas, we believe that we can identify the root causes of the inequities that exist by community and lay the foundation for action leading to sustainable solutions. The 29 indicators that you will see or find in the Equity Counts Data Center really represent the first phase of this, or the starting point for the center. There are more to come. So we encourage you to go in and look and explore for yourself. And with that, I'd like to introduce Michael Knapp and Lucas Braun from Green River to help us take that deeper dive into the data.
So hi, I'm just going to introduce us a little bit, who Green River is, who's on our team, and a little bit about what's gotten us here from a technical perspective. Just spend a couple minutes on that and then turn it over to Lucas Braun, who's our tech lead, our technical lead, and really headed up the software development effort to take a quick look at, or a sort of guided tour through the software itself, so you know where we are and where we're going. So I think the first thing to say, obviously this work exists and is as strong as it is and healthy as it is at the start, relatively recent. I think because of the collaboration with the Racial Justice Collaborative and United Way, this was a project where I felt like those we were working with just always put in the work and then some more, and that's made the project what it is. It's the collaboration, the excellence of the people we're working with, and I mean it, that is why we're all so excited today. And so thank you. At our end, I think I'll just introduce everyone by first name, but I kind of wanted to get you a sense, and I think most of us are here, of what it took at our end. We have Adam and Grace from our data science team doing data analytics, making sure that the indicators that go in to the Equity Counts Data Center are of quality, are of consistent, really coming up with the data management plan, getting those indicators really wrangled into shape. We had a front-end team, so those are the people who kind of design the interface for the software, the sort of human-machine interactions, if you will, the flow through the software. And that consisted of Eduardo and Jonathan and Ash. We then had a back-end team, those doing the kind of the heavy lifting on the software side, Todd and Lucas, who you'll be hearing from. And then kind of the amazing work of KT as our project manager. And we also have a director of project management, Erin, who's been involved as well. And our chief technology officer, Darish, has been paying attention as well. So it's a really big team coming in with different roles from software engineering. And I think, just wanted to tip our hat to all of them, and understand that this is a collaboration, not just with United Way and the Racial Justice Collaborative, but within Green River, a lot of different skills around software engineering. We're here, I think, because we've been working in health equity and social determinants of health as a focus at Green River for a couple of decades. And I think Tabitha, who you heard from earlier, found some of our earlier work in Connecticut that was very related, got us working in Delaware, I think around 2018. Our mission is to use software to affect change in the community, and we're very authentic about our interest in the use of software for social justice. We do think, we're software engineers, we do think it's the easy part. The work you folks do is the real part, and we're here to support you. So we are infrastructure on the great work you do. It is an absolute honor. I think this project represented in the several years we've been working with DPH, our first efforts to do something that's so important, which is to work with the organizations we're trying to serve, United Way, DRJC, many others, to really hear from you, give you a voice on what's done, build the software you want. That's what we've always had in mind. And this is an exciting step in that direction. And I think the last thing I want to say, it is a step. This is a first, it's an important first milestone, if you will, of sort of software's out there, it's live, it's been well thought through, but there's lots more to come with you. And I think, for me, the glass is always half empty. We just see so much more to do. I know we want to add census tracts right now. Our data is coming to you at the zip code level. We have in mind to build out a census tract level interface. We will be doing that. We want to get some local community organizations involved as well and hear from them. Just lots more to come, but I want to stay focused on what we got so far. And so turning it over to you, Lucas. Thank you.
Michael. And thanks, everyone. As everyone said, it's been a lot of work leading up to this point. And I'm really thrilled to have the honor to show the actual work to everyone. That's the accumulation of all of this work. I'm going to share my screen and we'll actually show you what the Equity Counts Data Center looks like today. So as has been said, this is part of a larger project headed up by Tabitha of the My Healthy Community website. And we've featured the Equity Counts Data Center front and center here, as it's an exciting new part of this bigger project. And when you come to the Equity Counts Data Center, the first thing we try to do is orient you to the purpose and the content of the site. So as you can see, we give a description of equity, the pillars of equity, the 4 pillars that have been identified, and we try to explain why equity matters at a high level for people coming here who might be exploring the data without already knowing these things. And then we quickly get into what are the pillars. We have the 4 pillars, and in addition, above sort of framing all 4 pillars, we have population data, demographic information to frame all the information we are providing. Then we go on to show all the locations that the reports are available at currently. And right now it's all the zip codes in the state, and we show those by county so that people can quickly find information that is important to them based on their geography. And that's a key part of My Healthy Community and this whole project, and has always been an important part of our work at Green River, is to frame all of this and focus it on very local health data, because we know change is made at the local level, at that community organization level. And that's one reason we focus so heavily on getting to zip code level here right away, not showing statewide statistics only. And that's often a challenge, because when there are small numbers, you get into privacy issues. So I'll get into later about how we got around that, and we still are able to show information for pretty much every zip code. So I'm going to click into the second pillar here. Actually, I clicked into a zip code, but I'll start at the state level. This is what it looks like when you come into the first tab here. Sorry, it's not a pillar, but it's the framing information, the population data. And for every tab, it's a similar structure where if you come in at the state level, we'll give you a map that allows you to compare between zip codes and ways to dig in deeper into the zip code level. So here on the population data tab, we're just looking at basic things that frame the situation. And for the state level, it's population density and the total population. For this demo, I'm going to zoom in here to a specific zip code. I'm going to go to 19802, which is a small zip code in Wilmington. And the purpose of this tab is to start allowing you to get some context for this zip code. Like I said, it's a small zip code, but what you can learn from looking at this tab is it's actually a quite populous zip code. The population density is very high compared to most zip codes in the state and the overall density of the state of Delaware. And on this initial tab, we also show framing information. like the state area deprivation index, median household income, and you can start getting a picture that this zip code has a lot of people, but it also has a lower median household income. So we're looking at potentially a poorer zip code than the other zip codes in the state. And it'll be interesting to see how that affects equity, or what the equity looks like in other ways in that zip code. So on this page, we also break down the population further for the zip codes. We show population by race, population by ethnicity, and population by age, because all of these are important demographic stratifications when looking at different kinds of equity. I'm going to go on to the first pillar here, which is health. On the health tab, we show quite a number of identifiers and statistics. The general categories are indicators around preventative health care, chronic disease and health outcomes, a bunch from adverse childhood experiences, which is a great data set we pulled in for this launch. And then COVID statistics, which is currently a very important overarching topic. I'm going to scroll through here a little bit so we can see generally what they look like, and pause on one in particular. You can see for most of the statistics, like we saw on the population tab, we compare to the state of Delaware. And when possible, we also break down the statistics by demographic groups. For all of these first ones, there wasn't enough data to do that. But when we get down to things like health insurance coverage, we start to be able to break things down. And so whenever we're showing something about a statistic, we show whatever is possible. If we don't have it, we just hide that chart. But when we have it, there is a chart. So when you come here and you're looking for information that's not there, it's probably because the numbers were too small. Know that we are showing whatever is possible when we have it. So here with health insurance coverage, we show the breakdowns by ethnicity, by race, and by sex. So here we have chronic disease and health outcomes, some more statistics compared to the state of Delaware. This can be very interesting to see how a particular zip code does compared to the general state rate. And I want to go down to a particular one stat on students. This is from the ACEs. This section's about students have been bullied in their neighborhood or at school in the past year. I'm just coming to this one because it's an example of how we can start looking at equity, how this can highlight issues of inequity. So in this case, we're looking at a statistic where when you come to this section, you see quite clearly that females are being bullied at a higher rate than males. And it just allows people in the zip code to know that might be an area to focus in. If you're looking at bullying, maybe you want to pay more attention to females in your school. And it starts to give people the opportunity to focus in on the issues that are most important. Okay, I'm going to go on to the next tab now, the next pillar. This is education. And the education tab is interesting because we shift away from zip codes here. As we all know, the education system is broken down by school districts. So we present the data at the school district level. I'm going to click into Woodbridge School District as an example here from Sussex County. And for schools, we show indicators around suspensions and expulsions, student performance assessment, and school enrollment and graduation rates. I'm going to go down to in-school suspension here and look at the chart for the racial breakdown of in-school suspension. And on all of our charts, we try to show as many stratifications as we can. If the racial groups are too small to show statistics without revealing people's private information, we don't show that particular racial group. But if we do show several, you can turn on and off the different racial groups by clicking here and focus in on just what you want to see. In this case, we're looking at now, I turned off the multiracial group, and we can compare in-school suspension among Blacks, whites in the Woodbridge School District. And you can see here that there hasn't been much change over time. There's disparity and it hasn't gotten better. So on these charts where we are able to show trends over time, it can be really powerful also to see what's been done, what hasn't been done, where change might be needed. On the criminal justice section, we're still looking in the context of the same zip code. Here we have, for now, just youth risk factors. And so we look at students who have carried a weapon not for hunting outside of school ever, and other statistics related to weapons, fighting, and police and incarceration. Finally, we have the wealth creation pillar. And here we show information about employment, income and poverty, housing, benefits, and the social deprivation index again. For this one, I want to go down to the section on employment. If we look at the unemployment rate, we can see that these kinds of charts, the trends over time. Again, here it does show improvement in disparities. The unemployment rate among Hispanics has dropped, and there's less disparity between Hispanics and non-Hispanics now. But by putting multiple statistics here, you can come down to the next section that's focused on poverty and see that there's more to the story there. If we look at the child poverty rate, on the other hand, and the Hispanic versus non-Hispanic rates, we can see that while the inequity in unemployment has decreased, there's increasing inequity in the child poverty rate. So I hope this was helpful to get a sense of what's on the site and the kind of information we hope people can draw by putting all these things in the same place where you can compare one thing to the next. And that's the real power of this. A lot of this data is available elsewhere, but not all in one place, not side by side. And I really hope everyone is able to use it and find it useful.
Lucas, we had a couple of great questions while you were demoing. Can you show where on this screen that you're on right now, how they see where that data came from, the about the data little link that's up there?
Yeah, of course. I glossed right over that we do try to frame the data with a small description. And then for those who want more details, we show the data source. And this leads you to a whole nother part of the My Healthy Community site, which is our data dictionary. And here you get into detailed information about the data and its source. And very, very importantly, there's the ability to download the data here as a CSV. So I know for researchers, often seeing something on a website isn't the best way to look at it. You want to dig into the data, put it in a spreadsheet so you can crunch your own calculations. And that's all here.
Thank you so much.
Any other questions?
I think that's it. I think we're ready to turn it over back to Emily.
Thank you very much.
Thank you so much, Lucas and Michael. It's always fascinating to hear from the developer's point of view about how you bring all of these different data sources together and make the information digestible for the users, and also present the data through charts and heat maps that really tell a great story about the inequities that exist across Delaware. So I'm going to talk a little bit more about using the data. So putting the data to use, because data is only so good as what we do with it. And we know it's a little part of the work that is all of our roles in trying to create a more equitable Delaware. So the ability to see that 17% of children in Delaware live in poverty, and that in some zip codes, close to 50% of children live in poverty. And where are those inequities existing, and what can we do to target resources, policies, and services to help combat those inequities that exist. So part of my role with the partnership initiative has been to work directly with a select group of community-based organizations because they are the one ones that are really the solutions to these issues of inequity. They're providing those resources and services where we need them. And so this data is really, really important to those organizations. So I am going to next invite Kirsten Olson, who is the Chief Executive Officer of Children and Families First Delaware, which helps children, youth, and families across Delaware thrive and reach their full potential. So her organization has been included in the partnership initiative and has been working directly with me. So she is going to speak a little bit more about that. Take it away, Kirsten.
Thank you so much, Emily, and thank you for that introduction. As Emily said, I'm Kirsten Olson, and I'm proud to serve as CEO of Children and Families First. And at Children and Families First, we believe that every child deserves the opportunity to achieve their full potential, and that investing in children and families is the single most powerful lever to create a healthier, more equitable society for us all now and in the future. Using brain science research as the foundation for our framework, we engage more than 20,000 youth and families each year in programs, services, and supports proven to prevent, intervene, and heal the immediate and often long-lasting impacts of toxic stress and trauma, which we know are impacted by inequitable access to what we all need to thrive. We offer services through a comprehensive continuum, including home visits to new parents, Head Start programs, foster care and adoption, school-based behavioral health, so much more. And we're committed to the use of evidence-based and evidence-informed practices. We want to offer services that we know work for children and families. And we also want to get the right services to the right folks at the right time and in the right place. And in order for us to do that, we have to understand the people and communities we serve. For CFF, there's no such thing as too much data. We actually asked our program leaders to take a spin through the Equity Counts database to see how it might support their work. Our EDI manager immediately saw the relevance around our efforts to build our EDI culture, to show the why of what we do through tools like the Social Vulnerability Index. Our Grants and Quality Excellence team recognized the significance in both concept development phase for grant writing, helping us define service locations, array of services and supports needed in those areas, as well as in making a strong case to funders from an equity lens. Our training team will be able to use the data for workshops and webinars related to EDI to really show those visuals that Emily talked about, evidence of disparities throughout the state to paint the picture around the importance of the work that we do and the work of equity. Our team is very excited about the opportunity to join the Equity Counts Partnership Initiative to develop some tailored data questions and reports in support of our work to help Delaware children and families thrive. In order for us to move the needle on building a healthy, equitable society where barriers based on race, gender, sexual orientation, and other identities are dismantled, we have to understand how these issues play out today. So we're really thankful for the opportunity to build on our longstanding partnerships with Department of Health and Social Services, the United Way, the Delaware Racial Justice Collaborative. Through this work, this is an exciting time for all of us to really move the needle and make Delaware a more equitable state and our communities more equitable across all the zip codes in which we work. So thank you all for being here, and I'm going to turn it back to Emily.
Thank you so much, Kirsten. That was great. So next, I want to turn it over to you, our participants, our attendees, and I want to ask you, how do you see yourself, your organization, potentially using the Equity Counts Data Center? So in creating the data center, we had an idea of how people, agencies, organizations might use this data. And I know that you just got a brief introduction to what exists there, but I want to hear from you. How do you see, or for what use might you use the Equity Counts Data Center? And you can simply post in the chat. Also hold for a moment. And if it's not totally clear to you, I can offer some suggestions. So as Kirsten mentioned, we have some, so the information could come in very handy for grant proposals. Exactly. I think that this data is really helpful for targeted and directed services and use of resources, so that we're accessing the groups of people in the communities that need it the most, and that there's not any excess or waste even involved in what we do in trying to eliminate inequities. So establishing priorities for investments, use of grant writing, targeted areas in need of improvement from our organizations, more granular and focused data. We can gather, the more granular and focused the data we gather, the better. Grant writing, targeting client populations. Yeah, so if you have an idea that you want to solve this issue, you see where are people across Delaware impacted the most, you can easily see serving seniors, so identifying age groups of people. You'll be able to see kind of where in Delaware are the 65 and older community making up more of the population, for instance. I mean, there's endless places that you can go when you have this data by zip code, with the ability to then disaggregate by race, ethnicity, gender, age, customizing programs to the specific needs of the area. Exactly. So if you have different programs across Delaware, and this zip code has a higher prevalence of diabetes, for example, whereas this zip code has a higher prevalence of heart disease, maybe you offer different services. That was just an example I came up with off the top of my head, but you sort of get the idea. And also maybe for marketing or better communication of the need that exists in Delaware, and how your agency or the work that you're doing is filling in the gap, or that the need that exists there. Great. And feel free to keep adding in those thoughts in the chat. So next, I'm going to talk about what's next for Equity Counts Data Center. So I want to be very clear that this is the first version of the data center that exists, and we are looking to continue to develop and expand by continuing to add data sets and continue to work more detailed and granular data at smaller geographic locations. We recognize that differences can occur across zip codes, and differences can occur across census tracts as well. So the more zoomed in and more detailed we can be to see what is happening and existing in communities, the better. So we realize that, and we're going to hopefully continue to progress in that way. But now that it's all said and done, and that a version does exist, we hope that this is another tool that you can add to your toolkit. I heard from the poll earlier that most of you use data every single day. So we hope that Equity Counts Data Center is one of those places that you can go and quickly get the data that you need. And we want to hear, Michelle mentioned earlier, we want to hear from you. We want to know how you're using the Equity Counts Data Center, what you think about it, what improvements do you think should be made, if any. So we want to keep this communication going back and forth. So I am going to paste the Equity Counts email into the chat. I am the one that moderates this email. So if you reach out, I'll be the one that gets your email. And I want you to let me know your feedback, how you're using the Equity Counts Data Center, again, the improvements that you think should be made. And additionally, I want to offer, if you think that this data center is really exciting and you want to transition some of the knowledge that you got from this webinar, or are curious curious in learning more, I'm happy to also schedule time with you and your work group or your team to talk about Equity Counts Data Center, or even just this type of surveillance data and how it could be useful for your organization. So you can feel free to reach out to me to request that as well. So with that, I'm excited because we're doing so well on time. We can move into question and answer. So I haven't had a chance to look at the Q&A box.
So Emily, we have a question, and I think this one might be great for Lucas to answer about the data. How often is it updated? And then is what's on there today the most current available? Because I know that's a great question, and also it has nuances. So I think Lucas is going to help us with that.
Yeah, thanks. So the answer is it depends on the data set. And in general, we're trying to keep all the data as up to date as possible. But it also, there are real costs to updating data. So it does depend on funding and our availability to update data sources. But I will say, for example, there's COVID data there that is updated currently daily. We're going to switch to weekly soon. But so there's data that's being updated at least weekly. And there are other data sets that are at annual level. So we wouldn't update them more than once a year. But wherever possible, for this first round, we've loaded up to the latest available, of course. And for all in the future, we'll be trying to keep everything up to date as new data sets are released by all of our sources.
Thank you.
I also wanted to highlight a comment that came through in the chat, providing context to the data in the future iterations would be great. To avoid blaming people for the disparities and inequities would be wonderful. And I would agree. I mean, it's very important to as to how we frame this data, and making sure that we're creating context for, we're creating the conditions and the structures that people live in. And those are largely to blame for the inequities that exist. So including that framework, and that should be quite clear as in how we present the data. So I think that's good feedback. If it's not totally honest, if it's not obvious on the Equity Counts platform. Let's see, what other questions do we have?
We're getting some great questions that are getting into the weeds, which is super exciting. So Lucas may know this one off the top of his brain. For the data from the American Community Survey, are you using the 1 or 5 year estimates?
Yeah, we use the 5-year estimates because they're better at smaller geographies. They're more accurate at smaller geographies, and they're updated more often.
So we have a couple of other data related questions specific. Aside from census data, where is the other info pulled? Can you give us a couple of examples of other data sources?
Sure. So a lot of the school and youth related data is coming from the Delaware school surveys. The COVID data comes from the Department of Public Health, and a lot of other health statistics come directly from the Department of Public Health, and their work as epidemiologists is to collect that data and make it available to the public. So we're passing that on. There's the ACEs data, and I think that's a few of the examples. There's a few others.
Yeah, and then one other question, and I think this answers that, is where does, say, for example, some of the education data come from? And that is from the Open Data Portal currently.
And then we had one, can you connect data sets by person, not zip code? And I'm going to assume that would be a privacy concern if I understand the question correctly.
Yeah, most of the zip code data is based on people's personal addresses where they live, but we can't say that somebody in a particular, or that a particular person has a disease. That's an invasion of their privacy. So that's where all of the difficulties come in presenting statistics at a small area. If you're talking about a really small zip code, just saying that one person has a disease is a violation of HIPAA law. So all of our statistics are aggregated and only displayed when there are enough people in that aggregation to make sure it's fully anonymous. Because especially with the population groups we're looking at and trying to help the most, we don't want to invade their privacy or reveal information that could be harmful to their well-being.
Great questions. And I love how detail oriented we are when we think about the data, the quality of data that we have on the website so we can best use it. Any questions that we haven't gotten to yet, again, feel free to reach out to me at the equitycounts@uwde.org website, email, excuse me. And I'll be happy to answer or connect or find the answer for you. Lastly, I am going to post a survey in the chat. I think it's 6 questions. It should take maybe a minute of your time. And we want to use that so that we can best develop and present webinars in the future. So that would be a huge help. You all know how important data is. So we're hoping to collect that. And I wanted to finish off by just making a few remarks about equity and our collective role and some would say responsibility in making sure that we are creating a equitable Delaware and making sure that all communities have the ability and opportunity to thrive, achieve their full potential, and even go further, have the opportunity to be healthy and have equitable outcomes. And so with that, I am going to end the webinar. Thank you all so much for spending time with us this hour. So excited to continue this work in making data available to promote equity throughout Delaware. Thanks so much.